Hello, welcome to the conversation between myself and a special guest, Dr. Kindal Robertson. He is a holistic dentist here in Calgary who operates Living Wellness Dental Clinic here in the northwest of Calgary. Him and I share mutual clients, and I wanted to get him on this call to ask him some very specific questions about something that may or may not be happening in our community. So welcome, Kindal. Thank you for being on the call with us.
Great to be here with you, Malcolm. It's always great to be with the Light Seller. Just really appreciate you having me. It's always fun. We always laugh a lot.
Yeah, we do. That's right. Cool. All right. Now, this is a topic. It's slightly controversial. It's one of those things that it's just the reality that we all live in and are experiencing right now. And I'm talking about masks. We've had the mandate since last August, at least in Calgary. There are some places that are continuing on them, including where we live, and there are some places that are dropping them. We're not going to get into those, debates and the specifics. What I wanted to ask a dentist about, one that specifically has, a holistic perspective. And, I had heard rumors about this idea of mask mouth. Maybe you have as well, right? So I'll let Dr. Robertson share what that is. Is it a real thing? Is it something that's showing up in your practice? What are those concerns? And let us know, while we have this reality of putting these things on our face, what can we do to, at least mitigate those effects if that indeed is real? So, yeah, I know there's many questions in that, but let us know what you're seeing and how we can navigate that.
Well, you're right, Malcolm. Anytime somebody, whether it's a thing or not, that's pretty straightforward. Anybody who's worn one of these things knows it's a thing. So if when you have to breathe your own air over and over again, and all of a sudden you realize, oh my goodness, it's a thing. Question is, why does that thing happen? And how does it happen? What exactly is going on that makes that happen? And what can we do, like you said, to mitigate it? I think those are some great questions. So why don't we start off, is it a thing? So the answer is yes, mask mouth is a thing. And you'll see it talked about in different internet sources, but even with my own association, the Canadian Dental Association, they actually talk about it. They have it right there on their website to say it's a thing. It's actually a collection of syndromes. And those syndromes or symptoms there's a variety of them. One of the ones that you'll notice probably most quickly is bad breath. Second one you'll probably notice is an increase in cavities or gum disease. You end up breathing more often through your mouth. So that's what causes a lot of these. So you'll feel that dry mouth, because your mouth kind of hangs open. You breathe through your mouth a little bit more. So mask mouth is a collection of those symptoms. And do I see it in my practice? Well, we've always seen it in the practice. Is there an uptake in it? Likely. But there's so many confounding things that are going on in society right now that it's hard to separate what is directly related to mask mouth and what's directly related to. A lot of my clients or patients that we see just haven't come in as regularly as they used to. And there's lots of reasons for that. They're either been isolated, or they can't get out, or they're stuck, or there's some fear out there about what's going actually on. And so you'll see, or they've lost benefits, they lost their jobs, they've moved. So the upturn in, or the difficulty in society right now has just caused a lot of challenges for people to actually get in and see it. So it's hard to say what's mask mouth and what's not. Anyway, I digress too far. So those collection of symptoms or syndromes is what we call mask mouth. Why does it happen? Like, how does that happen by just wearing something simple over our face? Where is that coming from? When we put something like this over our face, many of us notice that it's actually harder to breathe. We're feeling like it's difficult to breathe. And when we start going through this hypoxia, or this lack of oxygen, we breathe more. And to get more oxygen in, we often open our mouth. So we're breathing more through our mouth than through our nose. One of my colleagues often says that you don't eat through your nose, so you probably shouldn't breathe through your mouth. But anybody who's run any distance knows that, anyway, my mouth hangs open as soon as I can't breathe. Like, that's just the way it is. If I've got to choose between staying upright with my mouth open or keeping my mouth closed and falling over because I'm not breathing hard enough, the answer is our mouths will open. And so that's what often happens with these. As a result, our mouths get really dry. And that dryness gets rid of the saliva that is so necessary for all our oral cavity to manage. That's what causes the increase in gum disease and the increase in cavities. A big challenge with cavities is saliva actually fixes the problems that cavities are caused from. And without going too far into detail with that, dry mouth will increase the chance that you're going to get cavities. So yes, we know we get dry mouth from wearing masks, and dry mouth, the sequela or what comes after that is gum disease and increased cavities. You also find that because you're breathing through your mouth more often, that's where the bad breath comes from. And so we'll tend to smell that more often too. So the answer then, a very simple one, is close your mouth, which I hope your listeners aren't saying to me right now, but it's possible.
Yeah, and actually, there's somebody that I know that her whole focus of her business and in what she trains her clients to do is to become nose breathers, because she's got all this research around, if you're a mouth breather, how it even affects your your physiology, your physical structure, and she trains people to you put tape over your mouth at night, so that your mouth isn't hanging open. I was actually shocked. She went into the research, and maybe this is spurring on the next conversation. And feel free to share as much as you know about that, the difference between a nose breather and a mouth breather. I mean, you've shared a little bit in terms of oral health, but I know it goes even deeper beyond that.
Oh, you nailed it. That you just opened a huge new learning that's taking place in society right now. We're recognizing the value of keeping our mouth closed, not just because it's important for the short term, but also for the long term. I mean, breathing through your nose, you're right, we don't have time to go through it, but the increase in nitric oxide, which causes an opening of your your veins so that you have better perfusion of your tissues and the tissue exchange. A lot of people think, okay, I'm going to go off on a little bit of a tangent, but I'll try to hit two really important things. One is we often think carbon dioxide is bad. And carbon dioxide by itself probably isn't really very helpful, but you actually need carbon dioxide in your blood to transfer the oxygen from your blood, which you don't need it in your blood, you need it actually in the tissues. And you need carbon dioxide to do that. When we breathe through our mouth too much, we leak out all that carbon dioxide that prevents good oxygenation of the tissues, which is the important part. Most of the time, we just recognize it in the blood. The second thing that happens is good posture, which I'm not great at. I'm a dentist. I should do better, and I will do better. But good posture leads to good growth. Anybody who's run poorly in a wrong way and gets poor hips or poor knees knows that you have to do it in the way that your body's designed to use it. And our body is designed to have our mouth closed and breathe through our nose. And when we don't, our oral structures actually start to cave in. So you'll see the people who are mouth breathers tend to have like long, narrow faces and narrow arches because the tongue hasn't expanded the arch like it's supposed to. And so those are two things that, of course, we can delve more into. But at the end of the day, what we're trying to do is maintain good oral posture, which is lips are together, your teeth are together, and the tongue's at the roof of your mouth. And when we start to get into a hypoxic state or a lack of oxygen, really our body goes into a stress mode where it's just trying to fix the problem that we've now fallen ourselves into. And that's true with overexercise, wearing a mask, whatever the case may be.
Yeah. Wow. Okay. Amazing. So not just for your everyday oral dental health, but this goes so deep and so beyond that as well. So yeah, thanks for sharing those insights. And what I got from this conversation is, yes, mask mouth is a real thing. There are real consequences. Some of the quick fixes is, like you said, close the mouth, really begin to try and breathe through the nose. And honestly, even if that means, pull the mask down a little bit, if and whenever you can, to really breathe properly. And don't fear your dentist, right? Like, go visit Dr. Robertson and his team. So tell us a little bit about your clinic. You guys take a holistic approach. You're based in Northwest Calgary. And you and I, we share many of the same clients, right? Those that are into the kind of lifestyle and building their health, choose you and your team as their dentists.
Yeah, we're really looking at what the materials are that go into people's mouths. So we're really careful about that. Make sure that it's specific to them and works specifically with their chemistry in their body. That's what we're really interested in. And so as people start to suffer hopefully nobody suffers anything. I hope that everybody watches this video and they all keep their lips together and they all have good mouth posture. And the things I should mention that you can try to mitigate that is, 1, keep your mouth together. 2, keep very hydrated. So you want to stay as well hydrated as you can. That'll help your body create as much saliva as possible. Yes, like you said, visit a dentist. Of course, I'd like them all to see me, but really, as long as you see a dentist and you're comfortable and you've got a good relationship, I think that's really wonderful. The other things you'll want to do is keep your good oral hygiene so your habits are good, and of course, diet. So what you put into your body is going to be as important as anything else, the fuel that you're using to manage that. That's one of the things I love about the light cellar. I can always trust the stuff that I'm going to pick up there, even if it's chocolate.
For sure. Well, hey, one of the things I learned from one of your colleagues, Dr. DeSante, who works with you, because for me, I mean, it was one of those things, like I'm the second born, my brother, who, you know, him and I, obviously growing up, had the exact same diet. And I was the kid, you know, I did eat more sugar than him, but I was the kid, you know, constant, like cavities, like all the time, like dozens as a child that continued through, you know, adulthood. I've always had a challenge. And one of the things that, you know, despite eating, you know, a good diet, he really turned me on to is like, you got to give your, because sometimes I'm at the shop, I'm snacking all the time, right? And you mentioned that importance of saliva. He says, you know, take a break, you know, like don't eat for at least, you know, 2 hours. And I know that sounds kind of crazy, but as I really actually observed myself, I was like, oh, because I'll kind of like, you know, grab a snack here, I'll have a bit of tea here. Can you maybe just touch on that importance of really, truly, you know, I guess one could call it intermittent fasting, but in the context of oral health, where, you know, don't have anything in your mouth, let that saliva, you know, that's pure, just cleanse and clear your mouth.
Yeah, the importance of saliva can't be overstated. Like, really, it's what our bodies have designed to fix so many things. Like it's really, really a valuable topic. And one of the things it does is, like you just mentioned, it actually fixes our teeth. So without getting into too much detail about how that happens, but your teeth actually has layers. And the outside layer isn't alive, but it fixes itself magically all on its own. It's a mineral that actually remineralizes, and it remineralizes based on the saliva that we give it. So what happens as soon as we eat something, anything that the bacteria can eat inside our mouth, and some are worse than others. I'm sure your clients already know what that is, but if they don't, we'll go through it another time. But some are worse than others. Anytime food goes into our body through our mouth, the bacteria get the first crack at it. And when that bacteria gets a crack at it, they just eat and gorge themselves. And as soon as they do that, they start to create an acid. That acid is what actually erodes the mineral of our teeth. Now, on a microscopic level, that's not that big a deal. And so as soon as we take it in, the bacteria creates the acid eats away our teeth. Over the next 2 hours, our body actually fixes it. So we go through this cycle where we get demineralization, followed by remineralization shortly thereafter. And like you said, that's about a 2-hour cycle. Can you brush your teeth to fix it? And it doesn't really work. It minimizes the bacteria, but it doesn't stop the cycle. The cycle's still a 2-hour cycle. And so what you'll want to do then is you just let your body fix itself. What happens to many of us, though, is we eat a little snack, a carbohydrate of some type, and then we do it again, and we do it again, and we do it again. And as a result, we get more decay, because that microscopic decay that our body tries to fix becomes macroscopic decay, which our body can't fix. And once it goes beyond that outer layer, what we call the enamel, and hits the dentin, very hard to, your body doesn't do a great job of fixing that. And so that's when you got to come see a dentist. So, but if you can keep it in the enamel, your body will actually fix itself. So probably as a child, yeah, you enjoyed snacking a little bit. And some of us are like that. I'm as guilty as you, actually. That was my problem as a child. But now as adults, what you want to do is space that out and minimize what we call karyogenic foods, or the foods that actually cause cavities. Otherwise, it's fine. So I rarely tell my patients to kind of go cold turkey on all sugar, because I think that's pretty unrealistic. Nobody's very good at that. Maybe there's somebody out there. And if you're there, I'm very impressed. But most people cheat. And as a cheater myself, when that happens, the key is cheat when you're going to have a meal. Don't cheat before bed. That's like the worst time. Your saliva count goes down half as much when you sleep. So don't do it before bed. You'll want to try to, if you're going to cheat at a meal. If you're going to, one jelly bean is going to be as bad as 100 jelly beans. So really, you could skip all jelly beans. I don't think, if I'm going to cheat, I'm not going to use a jelly bean. Find something better. There's way better ways to cheat. But when you do, make sure you space it out. Give yourself at least 2 hours, but even 3 is probably better. And if you find you're getting more decay, space everything out. You just have to do more. And there's a couple different ways that we can try to fix that for people when they show up at the clinic. But really, it takes a bit of time to actually understand what's their pattern, why do they do it, what are their triggers, and then make sure that you can manage it. Some people need to eat more regularly. I've got a few patients that they've got a few conditions that cause that. So we have to work around that and make sure we can mitigate some of the challenges that are particular for them.
Yeah. Okay. Awesome. Well, it's been a great, highly informative conversation. I hope those that have tuned in have enjoyed, have learned something, and thank you so much for verifying mask mouth. It is a thing, and what we can do to try and mitigate that as we continue to move forward through this reality in society that we have right now. So, if folks want to connect with you, they can go to your website is lwdental.ca, correct?
Yeah. lwdental.ca is fine. So you can find us at lwdental.ca, and you should be able to find us. That'd be great. If not, I think you just want to make sure that everybody takes good care of their health, specifically their oral health. But I'm really worried more about their overall health more than that, which I think good diet, good control is what's going to do that for a lot of people.
Yeah. Okay. All right. Well, thanks for joining us, and I look forward to another chat another time.
Thanks, Malcolm. Great being with you.
Yeah. Bye for now.